Welcome to Pharma R&D Manager. This game is an educational business and management simulation. Players will immerse themselves in the dynamic management world of pharmaceutical research and development, navigating the challenging journey from initial discovery through clinical development to final regulatory approval.
We invite you to play, learn, and have fun.
The Pharma R&D Manager game always starts with the Start screen or Options menu. Later, during the game, you can always go back to Options menu by tapping or clicking the Options button.
What can you do on the Start screen?
Of course, you can start a game by clicking on Startup Company, Small Biotech, or Mid-size Pharma. Depending on your choice, your project portfolio and financials will be different. You can select a difficulty level, beginner, advanced, or expert before starting the game. In addition, you have the following options. First, Save Game, to save a running game by selecting one of 3 save slots. Or, second, Load Game, by selecting one of 3 slots. With Continue, you can continue your current game.
What additional options do you have on the Start screen? You can select Sound On or Sound Off, you can set background music on and off, and the Learn Online button opens an extensive e-learning manual in your browser.
Okay, now let's start the game.
3, 2, 1, go.
Pharma R&D Manager is a round-based strategy game. Before a new quarter starts, you can adjust your project portfolio, make HR decisions, buy and sell projects, adjust financials, check other supporting functions, and much more. After you made all adaptations and decisions, you then start the next game round by clicking on the Next Quarter button. All these decisions and adaptations are managed in the Central Management Dashboard. In the top menu, you always see the current financial situation of your company. This includes cash, your available cash on your bank account, planned, money/budget that is already allocated to running projects, debt, your current outstanding liabilities, total equals cash plus planned minus debt, the share price of your company, and the current project pipeline value. That is the value of your pipeline taking net present values and sales into account. Additional information you will find on the top right screen, the Option button to go back to Start menu, and the Help button. If you click on the Help button, additional question mark symbols appear on the screen, and by clicking them, you get more detailed explanations on certain items. This is your opportunity to learn. The calendar display shows you the current quarter and year in the game. In the middle of your Central Management Dashboard, you see an overview of your functional dashboards for your 3 main functions: Discovery and Research, Clinical Development, and Regulatory and Commercial. For each of these functions, the number of projects in the different phases are shown. You also see the average employee engagement and the effectiveness score of these functions, and if there are any open decisions you need to take. By clicking or tapping on these functions, you reach sub-dashboards to manage the functions in detail. The most important supporting functions can be managed via the buttons at the bottom of the screen: Drug Safety, Human Resources, Finance, and Business Development. Let's dive a little bit deeper into the game and make our first adjustments in the Discovery and Research dashboard. In all functional dashboards, you see the departments and their managers on the right. By clicking on the departments, you can enter the respective department dashboard. In the left window, you see the project portfolio of this function. For each project, you can see the project name and number, the therapeutic area, compound type, and in which R&D phase the compound currently is, and if the respective project phase is funded. That means if there is currently money allocated to this phase and how much it will cost to move to next project phase. By clicking on the phase, you can allocate a budget to it or deallocate budget from it. If you allocate money, this money is taken from cash and added to your planned money, and vice versa. In the project pipeline view of your Discovery and Research dashboard, you can see details on how good your compound is addressing the target. This might influence the effect of your drug. how toxic your compound is, toxicity, this might influence potential adverse events of your drug, and manufacturability, is it possible to manufacture your drug easily? If you click on a project, you can open a detailed project view, make adjustments, and later go back. Let's go back to the Central Management Dashboard and manage your clinical development function. In the Clinical Development Dashboard, you will see the Clinical Development Project Portfolio on the left with all clinical projects in your project pipeline. As in all other functional dashboard, you can easily see in which phase your projects are and if they are funded or not. If you want to mark a project for sale, you can just click on the For Sale column on the project to mark it for sale. Another click or touch unmarks it. If you need to make a project decision or want more details on a project, you need to click on the individual project to get into a detailed project dashboard with more information. In the project details, you will find, for example, the risk-adjusted net present value, peak sales, patent duration, and some additional details on the clinical program and the clinical studies. Don't forget, you can always use the help function to get explanations on technical terms. In the middle of this dashboard, you also see the details on the project costs. Here, sunk costs, this is already spent money, planned money, and the amount of project costs that is not funded yet. In the Project Decisions area, you can move the project to the next R&D phase or decide to put the project on hold or terminate the project. Let's go back and have a short visit to the Regulatory and Commercial dashboard. Here you see the Regulatory and Commercial project or product portfolio. For each project or product, you see if it is still in submission, or you can see sale details if it is on the market. By clicking on the project, you can open the project details and even see your product packaging. Let's go back and take a look at the supporting functions. In the Drug or Patient Safety dashboard, you see in the left window an overview of the adverse events for each of your drugs or products that are in a clinical trial or on the market. How are adverse events classified? To learn more, you can look at the chart on the right. A caution sign will appear if a potential safety signal is detected. Safety signals may indicate a risk to patients or trial success. Don't forget, if you want to put your project on hold or terminate it, just click on the project to go into project details. Let's look at the other supporting functions. Now to one of the most important functions in the game, human resources and leadership. In the HR dashboard, you will see your company's organizational chart with the different departments, their managers, average department engagement, and department effectiveness scores. Click on a department to go into the respective department dashboard. In the department dashboard, you will see in the left window data about your department's performance and KPIs, key performance indicators. In the middle window, you will see a detailed overview of the leader of this department. In below example, the department is Clinical Data Management and current leader is Roman Paul. On the left, you will see departmental KPIs, the engagement score, and department effectiveness and the development of these KPIs in the last quarters. You will also see the most important department-specific KPI. For example, for Clinical Data Management, this is last subject last visit to database lock, and you see if this KPI is currently best in class versus industry competitors. And you see the operating sourcing and IT model setup. By clicking on the different items, you can browse through different options and change, for example, the IT landscape settings or sourcing decisions. At the beginning of the employment of a new manager, you will only see a potential KPI range. In this example, People Development Ability KPI is between 45 and 65. After working longer with the leader, you will get, quarter by quarter, more insights and see more precise leadership skill KPI scores. By clicking on the Replace button, you can search for another candidate that you can hire as a new manager for this position. Oh, this one looks interesting. Now we go back and take a look at the Finance function. In the finance dashboard, you see a simplified profit and loss statement showing all revenues and all expenses, total earnings, and tax for the last year. In debt and interests, you see an overview on your debt and interest payments and can reduce and increase your debt if you have enough financial resources. You also have a more detailed view on the latest development of your company's project pipeline value and share price. By clicking on Sell or Buy, you can issue new shares or initiate a share buyback. You can never go below 51% to not lose control over your company. And now we go back to take a look at business development. In business development, you can either enter an auction or bidding process to buy a compound of another pharma company, or you can start an auction to sell one of your projects. If you want to buy, click on Left, enter bidding process. If you want to sell, adjust the details and click then on the right on Enter Selling Auction. Let's try to buy a project. The auction itself has three main windows. On the right, you see the company logo of the selling company, the project name, the therapeutic area, the compound type, and on the bottom, some contractual details regarding the ask of the seller. Some details are not shown immediately at auction start and are only marked with question marks. To simulate due diligence activities, these details will be only shown at certain time points during the bidding process. The different time points are shown as star symbols in the bidding timer window, which includes also a countdown from 100 to 0. When reaching 0, the auction ends, and the winner of the auction is the company that has the highest bid in line with the seller. In the auction window, you can set your bid by clicking in the bid grid in your company's column. You will see the amount that you offer. If you are the highest bidder, you see a blinking crown symbol at the top of your column. If you win the auction or find a buyer, the project will be transferred to your project pipeline. Or if you sold the project, it will be transferred the buyer's project pipeline. After you did all the necessary adjustments you wanted to do in this quarter, you can just click on the Next Quarter button and the next quarter or round of the game starts. Your virtual email client will open and you will receive messages from your team, supporting functions, or other companies. Click on Next to move to the next message. Read them carefully. Now the next quarter starts. Let's look and see how your company performed. This is the end of our introduction video. Can you make your biotech startup successful? Have fun, play, and learn. Enjoy the Pharma R&D Manager game.